There it is. Well, good evening, everybody that is tuning in and our panelists. My name is Tenille Lafontaine. I am moderating our chat tonight, and we have 4 physicians in this province that have given their evening time to us above everything else that they're doing in their day to answer some questions on behalf of parents and teachers and grandparents here in Saskatchewan, and on behalf of Safe School Saskatchewan, who put this webinar together. I'm going to introduce our panelists here quickly, and then we're going to jump into these questions that have been waiting from members of the public. So tonight we have with us Dr. Ayisha Kurgi. She's a consultant, there she is waving, and consultant pediatrician and associate professor of pediatrics at the University of Saskatchewan. She specializes in many areas, including general pediatric clinical testing unit. We have Dr. Nazeem Muharjarine. There he is, professor of community health and epidemiology in the College of Medicine. He's one of the leaders of a Canadian research network on coronavirus variants called COVARR Net. Then we have Twitter famous Alexander Wong. There he is, an infectious disease physician and clinician researcher with the Saskatchewan Health Authority. He works in Regina and throughout southern Saskatchewan. Last but not least, we have Dr. Karen Leis, a clinical assistant professor at the University of Saskatchewan. Give us a wave, Karen. There she is, at the Royal University Hospital in General Pediatrics. So thank you to the 4 of you for joining us tonight. I'm going to just make this an open discussion. Feel free to jump in with your answers. If you want to follow up with an answer, raise your hand and I'll pause to allow you to do so. We've got about a dozen questions to get through. We do have the chat open that people that are listening in right now and tuning in will be able to add some questions too. So to get started, I'm a mom of 3. I have kids getting ready for school. We've got school supplies purchased. Those supplies include masks, which have been a topic of discussion, of course, all summer long, and especially within the last few days with school districts sharing their plans. So the first question comes from a parent that says, I'm concerned about breakthrough infections for vaxxed teens who are sitting in unmasked 50% vaxxed classrooms. This parent says, I don't know how I can ethically allow my child to be exposed or infected in a classroom without protocols. I'm going to ask our 2 pediatricians, maybe this one first. How can I reconcile this dread with the benefit of being in a classroom right now?
Do you want me to go first?
Sure, go ahead.
Okay, it's such a good question, right? I think as parents, I'm a parent myself, and as pediatricians, we talk about this a lot. What is the right way to go and what is the right thing? We do know that masks do help, right? We also know that vaccines absolutely help protect you from being infected. They're not perfect. So there is still a chance that you will have your child exposed to infection if they're in a classroom or any situation where they are shared indoor airspace and there's not masking. So I would strongly encourage wearing masks, having those conversations with teachers to try and promote mask use as much as possible. It's a really tricky question, right? When you think about, I'm putting my child in a situation where there's risk. And I think it's always about weighing the risk and the benefit, right? So yes, there is risk with COVID infection. We also know there's risk if you choose not to put your kid in school, right? So you know your children the best. We know that some kids, I'm sure Karen would say the same, that we've seen lots of kids who struggled in the last year who weren't in school, right? Or even kids who did struggle with school, but the mental health impact of the pandemic has been huge. So it's about weighing that risk and what is the bigger risk for your child. The risk of the COVID infection, especially if you've chosen to vaccinate your child, you've done an awesome job. You made a great choice to keep your child safe. So weighing that risk versus the risk of other things that might happen if you choose to make a different decision.
If it's okay, Tenille, I'll just add to that we know, because Ayisha was just talking about vaccination, we know like from COVID vaccine or Pfizer trials that, the efficacy of a vaccine in an individual in preventing infection is about 95% after 2 doses. Real world data is close to that, probably 85 to 90%. and that includes asymptomatic infection. And so I think, you know, putting your child or having your child go to school, even if they might be in a situation where there are no masks, if they're double vaccinated, the chances of them getting COVID are very small, and the chance of them getting severe disease from COVID-19 is even smaller.
Go ahead. Dr. Wong, go ahead.
You don't have to call me Dr. Wong, Tenille. Alex is fine, please. So just to add to what Ayisha and Karen said, and I think this is going to be a sort of a theme of the evening, I think we all, for better or for worse, kind of have to start to work on coming to terms with the fact that we're not probably going to be able to protect ourselves and our kids forever from being exposed to COVID. You know, and COVID has changed so much over the course of the last, you know, year and a half. We're dealing with a completely different virus than we were like, you know, March of last year. And the contagiousness of this Delta is just so significant that it's honestly not really realistic to believe that you're not going to get exposed at some point. So the goal kind of has to change for those of us in rich countries that are fortunate enough to have access to vaccine, to a different sort of strategy where, you know, the focus really needs to be trying to, you know, kind of expose people, you know, when they've got 2 doses of vaccine in them. Because as was mentioned by Karen and Ayisha, again, your overall risk when you're a kid or a teenager of getting severe illness when you get COVID is very, very low to begin with. And if you got 2 doses of vaccine on board, you know, that risk goes down to almost nothing. I mean, you can't completely eliminate risk altogether, but it makes the risk benefit much more favorable to be in schools. And so that's the goal. And that's why it's awkward right now with kids under 12. You know, I've got 3 kids under 12 right now. And, you know, it's awkward because, you know, I'm kind of feeling this tension around, like, you know, do we try and, you know, just, again, their overall risk, even if they are exposed to COVID, is minimal, relatively speaking, but do you really want to be that one? So I think that's going to be an ongoing theme of this evening that we're going to talk a bit more about over the course of the next questions. Thanks.
Tenille, maybe I'll just add as well, because it's the first question. And, you know, I think, well, first of all, I just want to say that I also have 2 children, but they have left home. And a topic of conversation around this time of the year, just weeks before, days before kids go back to school, is how fortunate we are right now that we don't actually have kids who are school age. I just want to say that because that is a conversation that I'm having with my wife pretty much, you know, often, and more often than we want. I think back to the question, I think masking is important. So I'm not going to reiterate the whole thing about vaccination and so on. I think masking is important, but that is not the only thing that is important. It is one of several things that we have to do in order to protect. Vaccines, right, are right at the top to get your 2 doses when you're eligible, and wear a mask and distance as much as possible. And it is difficult and challenging in a classroom situation, in a school, playground, and so on, but also ventilation in a classroom, and also the community prevalence, you know, of the disease of COVID-19. We'll get to all of this, I think, a little bit more as the evening progresses. But I think the key message here is it's not just only one thing that matters in terms of keeping kids and their families and all of us protected. It is several things. It is that Swiss cheese model, or it is kind of, you know, layered protections, you know, that we have to be thinking about, not just only one thing.
Very good. Yeah, parents have a lot on their minds right now. You've got a lot of layers to think about, that's for sure. I'm going to remind everyone that's tuning in, go to the chat, add your questions. That's where our moderators can go ahead and give them to us to add on to what we're talking about right now. So we are still taking questions. We'll add that in. Okay, here's a big one. Asthma. Parents are concerned when they have kids that have asthma. So this next question is, I'm concerned about my teen with virally induced asthma. Is there any research showing vaccine efficacy against Delta for children or youth with asthma? Should she be staying home? Let's go to the pediatricians again on this one to start.
So we know that asthma, moderate to severe asthma, is a risk factor for more severe COVID-19 disease. However, I think if your teenager is double vaccinated, as we discussed, that risk almost goes down to nothing, which is good. The other thing that's going to be really important is keeping her asthma under good control. So that means, you know, continuing her regular controller medications on a daily basis as a preventative measure. Ayisha, do you have anything to add?
I think that's exactly it. You know, asthma has been listed as a moderate to severe asthma has been listed as a risk factor. I think the real world data doesn't necessarily show that, although what's going to happen in this new year is hard to say. Last year was a bit of a different year for respiratory infections in general, because with so much masking and distancing, all the viruses kind of went down, right? So we don't have a lot of data about that. I don't know what will happen this year, but I think what Karen said is exactly right. Make sure that asthma is well controlled. Extra reasons to make sure, you know, practicing good hand hygiene and distancing and masks to make sure that she's safe as well.
Great. All right, our next question is another popular topic that we've been hearing about in the news and on social media: rapid tests. Should schools be using rapid tests, and how could they be used most effectively? Let's go to Alex for this one.
So there's sort of the answer, and then there's the practicality and access to rapid tests. And I'm not completely certain as to what all the details are, but I guess the short answer is that if rapid tests are available and accessible for parents and families, then I think it is a useful tool. So the rapid testing, just for those in the audience, briefly is just, it screens for something called an antigen, a viral antigen. And it's, you know, it's almost, you put the swab in your nose, and then you kind of put it into a little test tube with a little bit of material in it. And then you drop it into this little doodad, and then it kind of goes across, and then you see sort of 2 bars, kind of like a pregnancy test. And 1 bar is good and 2 bars is bad. And usually you can get a result. I mean, they say 15 minutes, but basically within like a couple of minutes, you can pretty much see what the result looks like. It's not appropriate to use a rapid test for anything essentially other than for screening if you don't have symptoms. And the reason why is because if you do have symptoms, then doing that PCR test, which is kind of what we do in the labs, like in the lab in Saskatoon and the provincial lab down in Regina, is a much more sensitive test. So you don't miss positive results as much with when you have symptoms. And that's really, really important compared to this antigen test. But it can be useful, for example, if you have COVID, for example, and you're still sort of asymptomatic, but you're kind of ramping up your viral load, but you don't know it yet. And if you end up finding out that you have a positive test, then that is actually a very specific result that would suggest strongly that you do have COVID, and that could keep you from, you know, kind of going, you know, to class and getting into trouble and so on and so forth. So the short answer is that's kind of the role of screening with antigen testing in routine day-to-day life. The challenge, as I understand it, is that there's just some challenges with policy and protocol, which don't necessarily allow parents to necessarily take full responsibility of these tests and how these tests are reported and so forth. So I don't know all the details, but as far as I'm aware, it's not something that's easily accessible or available at this time for parents and students. So if it changes, and if the policy changes, and I believe honestly that this is related to something with regards to SHA policy, then it would be a very useful tool to add to the armamentarium. But as it currently stands right now, I'm not actually sure that it's widely available at this time.
Anybody else have anything to add?
I think we need to do more rapid testing. And I think it is part of a complement of testing, tracing, and self-isolation that we have to continually practice into this fall, particularly when the Delta variant is driving, you know, this wave, the current wave we are seeing. You know, it's interesting, in the past week, I've had 2 or 3 different people asking questions about where do I get a rapid test? My child is in childcare, and we as parents want to actually have a rapid test with us. We want to have several of these among us, and we want to use it. And they have done their homework trying to actually access this rapid test and have not been able to do so. So I think this kind of goes back to what Alex was saying. The practicalities of actually getting rapid test has to be improved. I mean, plain and short, because many of the other parts of the world, particularly the developed world, I know in Denmark, for example, and several other countries, rapid test has been one of the main ways that people have been doing tests on themselves as a screening step, not as a diagnosis step, but as a screening step. And I think we somehow have fallen behind in doing so. So we need to do that more.
Go ahead, Alex.
Just really quickly, I'll just say that again, I mean, if you as parents and families are, interested in accessing rapid testing, which I think you should be, then I think it would be a good thing for you to speak with your local school boards and school divisions and leaders within your own school boards and school divisions to ask about sort of what the status of rapid testing is and how, access and the practicality of getting access to testing can be improved.
That is a great point. Okay, so for everybody listening, to reiterate that if you do have concerns about rapid tests, talk to your school divisions, ask them where they're at with rapid tests for your kids at school.
If you want access, if you want access to it, just ask, like, where can we get access to rapid testing, right? That's a good place to start. Thanks.
Okay. Next 2 questions are looking at masks a little bit more. So this is again one that has come up among parents quite often. And the question is, do masks prevent young children from developing their immune system against COVID naturally? And I guess in another step of that question, are masks kind of infringing a little bit on children's ability to develop natural immunity to all the things they come into contact with at school? Let's go to Ayisha first for this one.
So if we look at last year's experience, we definitely saw that as mask use was part of our plan, masks, distancing, hand hygiene, I'll put them all there. We did see that there were less kids getting sick with viruses, right? Because they are protected from getting them. So yes, it kind of helps you. It helps you prevent you from getting sick with the virus. I think that's a good thing because it helps to make sure they're not going to get sick. I know there's lots of different things about masks and, we are stopping them from getting other viruses. I think right now that's good. There are some places in the States, for example, where when mask use kind of went away, then some of the other viruses started to creep up, and now you've got these kids that weren't sick all year getting more sick. So it's something that has happened. But I think knowing that we still have COVID out there and we know that they don't have the vaccine to protect them, I still think it's the safest thing to do. And again, risk benefit, I think protecting them from COVID with masks and things is a good thing. I don't know if anyone else has anything to add there.
I think the risk benefit, just as you said, Ayisha, is the key thing there. And there are a couple of other things too. I don't think the mask wearing is a permanent state of affairs. It's very temporary. And I think it is basically until we drive down this, this COVID-19. And so I think in the development of a child's life, from birth through the early years into school transition, there is something called hygiene hypothesis, particularly relating to asthma, atopy, and so on, which basically says that that kind of priming your immune system by by what you are exposed to, perhaps in a farm, if you're living in a farm, has been associated with lesser incidence of asthma in kids. So that is a hygiene hypothesis, somehow actually kind of primes your immunity into develop and so on. But we are not really talking about that kind of situation here. We are talking, but first, older kids. Secondly, we are talking about a fairly temporary, situation. And thirdly, I'm trying to think of a link between mask wearing and immune development in an 11, 12-year-old. Maybe somebody else knows that, what is the mechanism of actually kind of immune suppression because you have worn a mask for several months, and I just don't see that, in older kids.
Jumping a little bit further on the mask question, here's one. Why are we asking young kids to wear masks when so few young kids are getting really sick and being hospitalized? Who wants to take this one?
Well, I think that, so far we've learned that young children are generally spared the more severe disease that older adults have had. Canadian data shows that about 1.5% of children with COVID-19 will be hospitalized. The issue is that there are still a lot of unanswered questions. And, what we're seeing with Delta now is mostly, anecdotal from, public health offices, physicians working in hospital settings. And the evidence and published evidence always lags behind. And so there are still some unanswered questions about long-term effects of COVID-19. Although there's no, firm evidence to show that Delta is more harmful to children, we know that in this fourth wave, we can expect children to make a greater proportion of those infected, given that they're unvaccinated. And so, we're just a few months away from all those children getting vaccinated, and we've done so well we've done our best kind of worldwide and in Canada to protect those that were vulnerable before. And I think, it's prudent because we don't know all the answers at this point, and we don't know what the next few months will bring, to be cautious with our kids and protect them, and also minimize the impact on families. And to really to bring up a point that Nazeem said at the beginning, which is saying that he was thankful he didn't have young kids, and those in attendance today mostly would probably. Young families have been impacted quite a bit. Anytime your kid has been sick in the last year, how many days of work have you missed? How much worry have you had? And so, a few more months of some public health precautions, I think, is recommended, is safe from a public health point of view, from a scientific point of view, and so, I think we're almost there.
We've touched a little bit on this in our past few questions, but maybe I'll just get somebody to bring it home for us. And I think, Alex, this is going to be you. We're looking at the Delta variant now and masks. So why are masks so important now with this particular variant? How has it changed from, we were here last year having a town hall discussion and it's been a year and here we are again, but what's different with Delta and masks?
Yeah, so thanks, Tenille. I mean, again, we're dealing fundamentally with a very different virus than we were a year and a half ago. And it's hard for a lot of people to wrap their heads around this because it's changed so fast, so quickly. And that's part of why, again, all the recommendations and guidelines and so forth have kind of flip-flopped. And it's been really, really difficult to kind of keep up. But to make a long story short, I mean, Delta essentially is way more contagious, mainly because people develop much higher degrees of sort of viremia in their blood, which then translates to very high degrees of virus in their nasopharynxes and oropharynxes, and that's basically what determines your infectivity. So when you wear a mask, I mean, fundamentally, it's two things. You're obviously protecting everyone around you, because when you sneeze or cough, or even when you breathe, again, I mean, you're going to be releasing, some degree of sort of respiratory secretions, droplets, and so forth into the air, which when you're infectious. And so wearing a mask helps to reduce significantly the amount of all of that gets out into the environment. And then similarly, when you're wearing, a good, appropriately sort of double mask type fit, or sort of a medical grade mask, or one of these kind of KN95s or N95s, that significantly reduces the amount of virus that you get potentially exposed to. And the so-called inoculum, or how much virus you get exposed to, does play a role in terms of, how quickly you develop infection, whether you develop symptomatic infection or not, and so on and so forth. So reducing your exposure to the virus by wearing masks also can help, and probably and does significantly reduce the likelihood of you developing potentially severe illness, as has been mentioned. So for all of those reasons, I mean, it could go on and on and on. I think masking is one of these things which, for whatever reason, has become very controversial and a symbol of, there's been a political piece around all of it, when fundamentally it should just be about us trying to look after one another and take care of one another. There was never meant to be anything political around this. I mean, honestly, I used to go to Banff and make fun of all the Chinese and Japanese tourists that were wearing masks. And, now I'm like, what? They actually knew what they were doing. Like, they were actually kind of the smart ones here. I was the idiot. So to make a long story short, like, this is why I think masking does not cost anyone. It does not place anyone in any degree of risk. It essentially is like an all benefit, zero risk, thing that can help to significantly reduce the likelihood that we're going to have big outbreaks, in schools and in daycare settings and in other sort of congregated settings, which is frankly why I think universal masking in all school settings should pretty much be the norm.
That takes us to our next question. And anybody that's tuning in, Alex, we could hear your kids in the background. This is the reality of where we are right now. We have doctors
Paw Patrol
here
movie for the win, baby. Paw Patrol movie for the win.
But this is the reality, right? We have doctors here that are giving their time to us, and we've got the kids in the background, but it brings it home because this is why we're here tonight, right? So we're talking masks, we're talking the benefit. It's for everybody, but then Nazeem, I'm going to throw this one to you. What are your thoughts on, now that we're seeing this info coming from school divisions saying, well, yeah, elementary schools, we're going to say masks, but for high schools, we're just going to recommend it. So if masks are so important in stopping the spread, what are your thoughts on why they're just recommending it, not saying that they should be wearing them in high school?
So Tenille, I think just to build on what Alex said, I think all children returning to school who's going to spend a significant amount of time, 6 hours, 7 hours in a classroom with other children, some who are vaccinated if you're in high school, if you're vaccine eligible, some who are not going to be vaccinated. And then you have an adult who is teaching, maybe 2 adults in the classroom and visitors and so on. This is a congregated setting. Classrooms are congregated setting, schools are. And I think the right thing to do right now is to make masks required in both elementary and high school grades. But that's not the only thing that is important, going back to a point that I made earlier. Hopefully by tomorrow, we will release some information that we have been hard at work in the last 48 hours compiling. We've gone through 27 school divisions, back to school plans, and we have created a rubric using 7 indicators of public health measures, from masking, from social distancing, ventilators, some indication of community prevalence, and having some kind of review of their measures according to the prevailing COVID-19, as well as, so 7 indicators, we'll grade them, and we have an overall grade, A, B, C plus, C, and D's. And I hope that we would have completed that by this afternoon, but it's not ready yet to be released. It's going to come out tomorrow. This is all to say that the back to school reopen plans are all over the place, in this province, really. We have created some maps looking at the last 14 days, 2 weeks, incidence rate of COVID-19 mostly Delta driven by this time, by this point, and also fully vaccinated population. And it's interesting when you look at from the northern school divisions or COVID zones to the southern, there is a gradient. The far north zones have the high incidence rate, low vaccine uptake, and the school division sort of back to school policies are not really getting a high grade right now, but when you move in the middle band, sort of, west of Saskatoon, east of Saskatoon, and Saskatoon included, so Horizon school division and so on, those are the school divisions and the zones where we have low incidence rate, high vaccine uptake, and back to school plans that get a good grade, a B or A or B, for example. So I think the issue is that parents have to be asking questions of their trustees, school board trustees, of their MHOs and the government in general. Why we don't have a framework, a province-wide framework for back to school measures, rather than patchwork, quilt work of back to school plans, in 27 school divisions. This is not counting independent schools. This is not counting, First Nations, schools. Just only the public and the separate school divisions, and the French school. So last year, this time, there was a framework. It kind of got revised. It was released August 4th last year. It got revised by end of August. And you remember you had steps, where school divisions can move up and down the steps, given the given outbreaks and given the prevalence of COVID-19. This year, we really don't have anything like that. A framework, a policy that is province-wide. So each school division is left to do what they have to do. And they do many different things, basically, So I think that it is time that parents, teachers really ask for this, ask their school trustees, school division leaders, but as well as their provincial representatives. I am getting political because I think it has been politicized. There is a political answer to this, going forward. And so we cannot shirk away from politics. As Virchow said, in 1800s, 1850, medicine needs politics writ large. and we just cannot actually, we cannot hide away from politics, and we have to face it, and we have to deal with it.
Okay, well, I think that's a great point to mention to the people that are here tonight. Many people that are watching are part of the Safe Schools Saskatchewan page on Facebook, but maybe you're not, and you just saw the link on Twitter today, or a friend shared it with you. The Safe Schools Saskatchewan page on Facebook is a page for community members, teachers, parents, grandparents to come together. They create some amazing events. There's a lot of discussion there. So we do need to speak up as parents and educators and ask those questions and speak to those school boards and trustees. So I think that's a very good point, and big purpose behind Safe Schools Saskatchewan. Going further on the masking question, this is something that's happening in my school district. Masks are going to be worn in school, but not outside at recess. So how concerned should parents be about the Delta variant when the kids are outside at recess with their masks off? Let's go to Karen for this one.
I may want some of the others to weigh in on this. I think the risk outdoors is substantially less, so I think that's on our side. We know that Delta is more contagious, so it's hard to know which one is going to be the bigger factor.
Mm-hmm.
So I'm not sure. I'm not sure about that. I think it remains to be seen. I don't know what others think.
Let's throw it to the others. Anyone else have an opinion on that one?
Well, I mean, I think that, well, when we look at the back to school plans, very few school divisions, if any, really say anything about wearing masks during recess or when kids are outside, etc. And I think it's rightly so. I mean, like Karen was saying, I think what we have learned is that outside is safer than inside. That being said, there are these anecdotal reports where Delta has been transmitted in the briefest encounters, between people, one infected, carrying the virus, other not. But I think anecdotal reports like this doesn't make a scientific report, so we have to actually take this with a healthy grain of salt, these anecdotal reports. But you know what? I mean, I think we have learned a lot from case reports, throughout this pandemic. Ventilation, for example, one of the best case studies came from a restaurant in China, where people who were seated and eating in the stream, of air that was being spewed out by the ventilation system got. This is not Delta, it was the original or the initial strain of the virus. But people who were seated just a few feet away from that stream of air being blown did not get infected. So case studies like this, case report like this, can be very helpful for us to understand and learn, how virus is transmitted. I think we cannot say it enough. Delta variant is a different type of a virus than any of the three other variants of concern that we are dealing with. Where R naught or how many people that are infected person can pass the virus on, 5 to 6 people compared to 1 to 2, with the previous variants. So it's double, almost more than double the infectivity, of the previous variant. So I think, we have to look at this coming fall, in schools in a different way, than we did, last fall.
Go ahead.
Sorry, I was just going to add to that. And I think for whether we're talking about masks being required versus mandated inside for the older kids, whether we're talking about masks inside or outside, I think what we need to be is we need to make sure that we are responsive to what's happening, right? So what the plan that we have now may not be the plan we have in a few weeks or a month. And I think we all need to be willing to respond to what's happening in our community, right? Whether it's in the community level, what's happening in the hospitals, I think we need to be flexible. And as frustrating as it can sometimes be with things changing, I think we need to be ready and willing to accept that things might have to change.
Go ahead, Alex.
Just one really small, I would completely agree with Ayisha. I think, again, I mean, it's hard to know exactly what the province is going to do, but I know that, the consensus document, which came from the 13th, from all the sort of local MHOs, that document is going to be revised, sort of on a real-time basis, depending on what we see in terms of the degree of community transmission across the entire province. And that clearly is going to, frankly, just explode over the course of the next several weeks. And so it would not surprise me at all for that document and its wording to change, for example, say from strongly recommending masking, for example, to required masking, just based on the fact that there will just be so much community transmission that it will be inevitable that there will be, again, significant presence of Delta in schools. So it's not to say that, we're just, as Ayisha said, like it's going to be a moving target. And just for the record, I mean, for my 5-year-old and for my 3-year-old, I probably will not push really, really hard to have them mask outdoors just because it's tough, especially in the wintertime. It's tough.
Okay. I'm going to come back to you, Alex, with this next question because we did sort of touch on it, but maybe you can give us some numbers. What is the prevalence of Delta the variant in Saskatchewan? And what are those projections in our province without any health orders? If we have no health orders and we have Delta as it is today, what are we looking at in the weeks ahead?
Probably hundreds of cases a day. It'll really depend on, again, the degree of testing that takes place, because obviously, the number depends on how many people go and get tested, and that's going to then push testing capacity and so forth. But, we have good examples in what happened, for example, in the southern US is still obviously happening in the southern US right now. It's not good at all. There's huge outbreaks going on. And even though, again, just to be clear, I mean, in Saskatchewan, our overall vaccine uptake is definitely much better than the worst states in the southern US. Again, I mean, it's probably not going to be good enough for us to avoid, a reasonably significant surge in hospitalizations and ICU admissions, and, there's going to be deaths. So that's just the reality of it. And it's pretty much 100% Delta now across the entire province. There's basically no anything left. So it's all Delta. And again, I mean, we're in a situation now where the overall provincial mentality, I think for the last, I don't know, like 7-8 weeks, like since July 11th has pretty much been, it is what it is, everybody's kind of do their thing. And we've seen, again, just a natural relaxation of everything in terms of precautions and so forth. You go from seeing 70-80% of people, in a grocery store wearing a mask to like maybe now 10 or 15% of people wearing a mask. That's just the reality of it. So we're obviously hopeful that there will be policy measures and other pieces put in place depending on sort of what the cases and obviously hospitalizations and ICU numbers look like. And for better or for worse, right now, it looks like our bellwether is going to be Saskatoon, because there's widespread community transmission in Saskatoon, a lot of cases, the wastewater doesn't look good. And right now Regina looks relatively spared. So I think, again, for better or for worse, I mean, just like Regina got hit hard with Alpha in the third wave, that's going to probably be what we're going to see in Saskatoon, is really going to be, what tells us how the rest of the province is going to go.
Okay, I'm going to ask a bit of a hopeful question next, and then we're going to jump into some of the questions that we're getting in chat. We are at almost 7:45, so if any panelists are able to stay a little bit later as we go into our chat questions, we would love it if you can. If you have to leave, I understand that too, because we know we're taking your time this evening. Here's my hopeful question, guys. When are we looking for that vaccine for under 12? What are the projections looking like right now? There's so many rumors out there among parents. What do you know and what can you share with us? Go ahead. I can't hear you.
Nazeem, do you want to take
There
it?
you
I
go.
mean, I've answered this question so many times, so. I think
You're on mute.
Nazeem, you're on mute.
I said that, why don't you? And then I'll just follow up.
Sure.
If you have, yeah.
So again, I mean, everything is super top secret, obviously. But, I think most people who are kind of in the know at this point in time would expect that the data and the filing to the regulatory authorities, so that would be like the FDA in the States, Health Canada here in Canada, and the EMA in Europe would probably happen sometime for ages 5 to 11 by the end of September. That is kind of what we're looking at. And again, I can't say I have any insider information. I text my Pfizer contacts all the time. They're like, yeah, we can't tell you anything, but that's probably what we're looking at. And so from there, the question becomes like, how fast will the regulatory authorities move? There's obviously huge pressure on regulatory authorities to move quickly with this file. And so I suspect it will move quickly. And probably get emergency authorization pretty quickly as long as the data is reasonably solid. And again, reminder that it's not clinical data we're looking at. We're looking at immunogenicity data, so antibody data and so forth as a correlate of protection. And then from there, we need our clinical guideline bodies. So, that would be like the CDC in the United States or NACI here in Canada to move quickly and provide recommendations, which could then be considered and implemented by the provinces. So best case scenario, I don't know. I mean, we're looking optimistically sometime, absolute best case scenario, probably like mid to late October, and it's probably going to move really, really fast when it does. Obviously, we're going to get like huge lineups again as we had like before. That would be my best guess. And then for ages 2 to 5, probably expect the file to move relatively quickly, like a week or two thereafter. The data is just lagging behind a bit because it took them a bit longer to recruit the trials. And then for age 6 months to 2 years, probably a little bit after that as well. That's the best knowledge that we have at this time.
We're good. Okay. Go
that's
ahead.
very optimistic. I'm glad to hear this as well. What I read is, was putting the date into December. But, I like your story, Alex, better than what I read.
I just said best case scenario, and I there's going to be so much pressure on everyone to move very, very, very fast because Delta is going to be blowing up everywhere. So I don't know. I'm being perhaps a bit optimistic, but I know that, there's going to be some variability with that.
Yeah, it's not a bad thing to be optimistic particularly in these times. What I also know is what I read is that the number of children who are in these trials are not that big. We are not talking, multiples of 10,000s of children, but rather thousands, like 6,000, 5,000, 6,000, 7,000 children, as opposed to the clinical trials that were done on Pfizer and Moderna, which had 50,000, 70, 80,000, adults. But of course, we are looking at from 18 to 90, 100, as opposed to just only 10 years. First 6 years, 7 years, and so on. But it can come soon enough. is the takeaway, I think.
Isn't that the truth from every parent and educator and grandparent that's listening tonight? It cannot come soon enough, and that's what we are all waiting for. And we're at that bridge point right now between where we're at now and getting to that point where kids are vaccinated. So here we go now to a not so positive question, but question on ICU beds being filled. How many ICU beds are there in Saskatchewan, and what will happen if they're full? Who wants to take this fun one?
I can take it if you want.
Sure, please.
Can I just throw one other small thing just with the last question about vaccine? Just, obviously we're all extremely hopeful, and I'll be the first to be lining up, with my 5-year-old when it becomes available. But there obviously there's limits in terms of especially the safety knowledge of the clinical trials and, what the incidence, for example, of heart inflammation events and so forth will be in younger kids. And so I just want to say that purely just so that everybody understands that there's limitations in terms of, what we can glean in terms of safety with clinical trial data. And, it's small numbers, as Nazeem mentioned. And once we get that real world data, when literally millions of kids are all going to get vaccinated pretty much all at the same time, then we're going to start to see and understand a little bit more about it. And there probably will be a safety signal here and there, and it will probably lead to some of the same angst that we saw, with myocarditis and pericarditis, with younger individuals and young adults and so forth. So just putting that out there so that people don't necessarily, are at least aware of it. To answer the question about ICU beds, I don't actually know the exact number. It's probably on the order of about, I don't know, like 120 or something like this. I don't know the exact number, but again, the health authority has the ability to make more space and make more beds. And so I think it's less of, the issue of, the physical space and the ventilators and all that type of stuff. The real actually strain is the fact that we just don't really have staff, specifically nurses and human resources. There's just a huge, very specialized group of people that are, that have the knowledge and the skill set to be able to look after the very sickest people. And unfortunately, for better or for worse, a lot of those people have either decided to take a long break or moved on or burned out or decided to move to different areas. And so, that is going to be, I think, what the strain with the system is going to look like. Here in Regina, obviously, it was bananas in March and April, and, we pulled staff, that were 10 years retired to come back. And I'm just not sure that we're going to have that kind of capacity again. There's already starting to be some anecdotal strain in Saskatoon. Those numbers are going to keep going higher and higher. So again, I think we're going to have to watch Saskatoon closely as a bit of a bellwether to see what happens. And then when it runs out, it's no different. We're going to make beds. We're going to try to do the best we can. to hopefully reach a point where we're not going to have to actually start to make like real triage decisions and so forth, you know. And even in Regina, it was nuts. But we were still able barely to, you know, again, like look after everyone and not force people into really difficult, bad triage situations where we had to let people who we otherwise would have tried to work hard and save, let them go.
Right, right. And I think a lot of us watching tonight can, I can't even say can't relate to that, but the reality is the majority of the public just didn't know what the reality was in terms of beds and hospital and the workload, because we didn't see a lot of that. We heard about it. So we need those stories to be told. And I appreciate that when they are shared, because we don't, for as much as we hear and there's rumors and whatnot, I know that the reality of what was going on is just not heard. This question, I think, is an important one. And someone is asking about the effectiveness of vaccine for immunocompromised individuals. So they've already gotten their vaccine, but what are the risks for vaccinated immunocompromised individuals? Is that enough, or are they still likely to get quite sick with Delta? I'm going to go to Ayisha for that. What do you think?
It's a really good question, right? I think that we know the vaccines aren't perfect. So as much as we can do our very best to make sure that we've gotten our vaccines, we know that whether you're immunocompromised or not, it's still possible for you to get sick with a vaccine. I don't know the specific numbers of what the risk would be if you're immunocompromised. Certainly, if you're immunocompromised, your risk would be higher of having more severe illness. I think the key thing there is, like we've been talking about all night, vaccine is part of it. It's also trying to keep yourself and everyone around you safe, right? So when you go into the grocery store, you still wear your mask. You make sure you are limiting your contacts and making sure you're distancing and being as careful as you can so that you do stay safe. I don't know if anyone else has anything to add to that.
I think one thing to add to that question is that two things. One is that those who are immunocompromised were prioritized in the vaccine campaign. So they got their vaccines in the first couple of months, since it started to roll out in this province and in every other province as well. So they've had the vaccine for a while. If they're fully vaccinated, 6 months, 7 months now. And if there's any waning of vaccine efficacy in people are happening, it's going to happen first in among those people, immunocompromised people by now, August, September. So if you're looking at boosting, immunity of immunocompromised people, they will be the logical, choice to get a third shot. And some jurisdictions, some provinces are giving booster vaccines, to those who are immunocompromised and who are in treatment and so on for cancer treatment and that kind of thing. So I think that needs to be added. I think the whole booster dose or third dose need to be done thoughtfully again. I really don't think there's an ethical question. It's an ethical question, just not only actually who you give the third dose for to boost the immune level, but it's an ethical question in relation to global equity of vaccine as well. Most of the rest of the world outside of developed countries have hardly one dose, let alone 2 doses in African countries, for example. Right. And this is a pandemic. It's not just only a disease in Canada, in the US. It's a pandemic, meaning it's a global issue. And everyone has to get, vaccines, get access to vaccines, and need to get protected. That's how we are going to drive down the variants emergence, as well as, finally drive down COVID-19 right. by protecting everyone, not just only people in Saskatchewan, Canada, but every part of the world.
Thank you. Something that hasn't come up in our discussions yet, and a few people have asked about it. What do you know about long COVID in Saskatchewan? What has been discussed? What have you seen? Duration of symptoms, prognosis of disabilities, productivity, neurological effects. Maybe I'll go to both of our pediatricians on this one. What have you seen or have concerns from parents on these types of questions? Because I think about it as a parent myself. I have, that child that doesn't have the vaccine, and okay, maybe they may get COVID and they may be okay, but what about long-term effects? Is that a reality and something that I need to be, among all the other things, thinking about when I'm falling asleep at night? Ayisha, I'll go to you first. Sorry, Karen.
So this is a huge important piece, and I think Karen touched on it a little bit earlier, actually, that we don't know yet a lot about the long-term effects of COVID, right? Which is one of the reasons why it's extra important that we still pay attention to keeping our kids safe, even if we know that the risk for their acute respiratory illness might not be as high as it is in adults. What I've seen, I don't have a lot of Saskatchewan specific information on long COVID, but there has been some studies internationally. And we were just looking at some, Karen and I together, actually. What we saw was, I think about 2% of kids have symptoms lasting 8 weeks or longer. Don't know a lot about what it's going to be, but certainly they're not immune. So it's not as big of a, just like COVID itself, the risks in adults are higher and the numbers are higher of severe illness. It looks like the numbers for long COVID are higher in adults as well, but kids are certainly not immune to that. And there's definitely kids who do still suffer long-term effects from it.
Karen, do you have anything to add?
Yeah, I think it's still evolving. It's significantly less than in adults, where they're seeing 1 in 10 individuals having long-term symptoms. So about 5% will still have symptoms at about a month, and like Dr. Kurgi said, 2% at 8 weeks. And so this is just coming out. I think in terms of actual what those symptoms are like. Mostly like headache, fatigue, sometimes breathing difficulties, some reports of neurological or mental health sequelae as well. But we just don't know much more beyond that, unfortunately. And in terms of our own clinical practice, like Ayisha and I think I've seen one case in the last year. Again, that's very anecdotal, but we're not seeing a lot, but we're starting to discuss about, how to manage those patients and who should be seeing them.
Okay.
Tenille, I'll just quickly add, there is a group of people, researchers, actually quite a big group, who is looking into long COVID in Saskatchewan, not just only focusing on pediatric populations, but just general population of people who would have been infected. And we are kind of doing this quite thoughtfully. There's a proposal out there to the ministry, trying to look at long COVID and track long COVID and study long COVID in Saskatchewan. But Saskatchewan is not the only province who's doing this, obviously. I mean, every other province in Canada. The best data that I've seen comes out of UK. I mean, and both in terms of responding to long COVID, as well as actually tracking and studying long COVID. This is where I fear that infectious disease might turn into a chronic disease. And we have seen this before, HIV, for example. So I think long COVID is not something to trivial. Well, nobody's trivializing it, of course, but we are still learning what long COVID is, even to actually define it in a solid way. But I think long COVID is that, in a way, the unknown, that unknown that create a significant issue, ongoing, for humanity. It's where actually infectious disease could turn into a bit of a, chronic disease. By saying this, I'm not trying to instill more fear, more worry, but it is a reality, and it is something that we have to think about when we are thinking about public health policies, now and going forward. It is not just only about cases, hospitalizations, and ICU bed use. It is also about long COVID, so that really needs to be taken into account.
I agree. We've hit the 8 o'clock mark. I don't want to keep you much longer. I know that you have given so much time to our community and to our kids. and to patients. So I appreciate your time this evening. And I'm going to leave you with one last question, because we have so many parents and educators and grandparents tuned in tonight. And I'm going to ask you each one by one. I'm going to start with Nazeem. If there were one tidbit, piece of advice, or statement that you would give to parents right now, looking ahead next week to school, what would you say?
Kids are resilient. I say that, based on my personal experience with our daughter, at birth. Kids are resilient, and worry about them, but don't, and keep them safe. Make sure that you are safe and keep them safe. But know that we are going to get through this. We are going to get through this, all in together and in one piece.
Okay. Ayisha, I'll ask you next. What would you leave parents with tonight?
I think the best thing I would say is give yourselves grace as you go through this, right? This is unprecedented for all of us trying to make these decisions. It's a lot of weight to take on, to feel like, am I making the right choice? Am I making, am I putting myself at risk, my children at risk? It's okay. We'll figure it out together. And it might be something that changes over time, right? But you know that you are doing the best that you can with the information that you have right now. And that's okay to make whatever decision you make right now for your kids and your family. You're making the best decision as long as you've got their best interests at heart. We'll figure it out as we go.
Thank you for that. Karen, what would you leave us with tonight?
I think similar type of messaging. There's a lot of uncertainty in everyone's minds, some uneasiness, a little bit more than last fall, to be honest. And I think as best we can, the message we should transmit to our kids is, this is business as usual, like last year. We're still going to wash our hands lots, distance as much as we can, wear our masks, and not to transmit too much of that anxiety to our kids. And I think, if you have specific questions or concerns, write messages, letters, emails to your school division offices, to our MLAs, and we'll just hope that that we do okay.
Alex, what would you leave parents, grandparents, educators with as final words for tonight, looking ahead to next week and school starting?
So I'm just going to sort of be blunt. My kid's starting kindergarten, he's 5, and I've already sort of worked out in my own head the fact that, as long, I echo what everybody else has said, if you're doing the best you can and your child is doing the best that he or she can, then it's okay, and it's going to be okay. And whatever is going to happen is going to happen. And unfortunately, what is going to happen over the course of the next several months is that there's going to be a very small number of kids who are going to have a not so awesome outcome. But honestly, everything in life is about balancing risks and benefits. It's not fundamentally different than when you go out in the middle of a blizzard to take your kid to school. There's a risk associated with that, right? A very significant risk if you're an Asian driver like me. So practically speaking, with essentially no public health measures in place, widespread community transmission, we are going to see, significant transmission in all settings, including schools and daycares. And we just kind of have to be okay with that, because as has been mentioned, virtually all kids do okay. And as has been mentioned by Karen, all of the mitigating measures that we had in place and that we cared so much about in terms of hand hygiene, distancing, not touching our hands to our eyes, nose, mouth, and face in general, and masking at all times, other than perhaps outdoors. is really the best that we can do for unvaccinated kids, right? And short of keeping them out of school, which honestly is not something that even for a moment played into my mind, or keeping them out of daycare, which didn't even come, again, there's just so much benefit that the benefit just outweighs that risk. But for those of us who were lucky enough to avoid, isolation and, positive case, over the last like 16, 18 months, you sort of have to be prepared in your own headspace to, be in that situation where, probably going to have, it's just going to be the reality of what we're going to have to deal with over the next few months. So be okay with it. Don't beat yourself up. And again, we're all just trying to do the best we can, but we can't protect our kids 100% of the time. All we can do is the best that we can.
Great advice from our 4 panelists tonight. Thank you so much for your time. I know Safe Schools Saskatchewan is going to put this on YouTube so that you can share it. If any of you watching tonight have, maybe you have a relative you want to share this with, or somebody that is waiting to be vaccinated that you want to talk to about this, this is the information that can be shared with them. Safe Schools Saskatchewan is a group on Facebook. Again, it's comprised of parents and teachers and grandparents, educators, working towards making school safer for kids. And we have, thankfully, have such great people like the doctors that have joined us tonight that are contributing their knowledge. If you want more information, join the conversation. Safe Schools Saskatchewan is always there on Facebook. They're also on Twitter as well. And I know that our panelists, the majority of them are on social media as well that you could speak to. They're always happy to share. Thank you to Safe Schools Saskatchewan for having me host as well. It's been a pleasure to meet all of you via Zoom tonight. Your words mean a lot, and especially that last part that you mentioned as a parent. I know other parents listening will take that to heart. We got another school year ahead of us. We're going to do the best that we can, and we're going to, try and protect our kids as best we can with the knowledge that we have right now. Changes every day. So thanks, everyone.
Just gonna throw one last thing out there.
The
most important thing we can all do is encourage everybody to get vaccinated to reduce community transmission, which is going to reduce transmission in schools. I did not say it. I should have. I'm sorry. That goes without saying. Message.
Vaccinate, vaccinate, vaccinate. We know that. That's without saying. Wear your mask, wash your hands, safely distance, kiss your babies, take care of your kids, and parents, give yourself grace too, because we've got another school year to come. And then parents, we're going to take a break after that first day of school and maybe do some Zooms and some virtual high fives, because it's been a long summer too. Thank you, everybody. Good night.
Good night. Bye.